Masturbation is one of the most natural and common ways humans experience sexual pleasure and self-discovery. It's an act that nearly everyone engages in at some point, yet it continues to be surrounded by myths, stigma, and misinformation. As a urologist and pelvic surgeon, I often remind my patients and my viewers that masturbation, when practiced safely, is a perfectly healthy and normal part of sexual well-being. It can relieve stress, help with sleep, improve mood, and even foster a better understanding of your own body. But one question I get asked more than almost any other is, how much is too much? The truth is, there isn't a magic number that defines what's too much. The key lies in how it affects your body, mind, and daily life. When done in moderation and without harm, masturbation can be a wonderful form of self-care. However, certain habits or techniques can unintentionally lead to physical or psychological issues that impact sexual health. Today, I want to explore 3 specific ways masturbation can cause harm and, more importantly, how to recognize and prevent those problems. Let's start with something called traumatic masturbation syndrome, a term first introduced by Dr. Lawrence Sank in 1998. This condition describes a pattern of masturbation that involves lying face down, what's called a prone position, and thrusting against a hard surface, such as a bed, pillow, or mattress. While this position might provide intense stimulation, over time it can lead to problems like decreased sexual desire, difficulty achieving orgasm, or even erectile dysfunction. Although research on this topic is limited, anecdotal evidence from clinical practice supports that this habit can alter how the body responds to stimulation. In one large study of nearly 600 men who identified as having premature ejaculation, researchers found that those who engaged in prone masturbation or other forms of intense, friction-based stimulation were more likely to report sexual difficulties. The mechanism behind this isn't fully understood, but it likely involves overstimulation of nerve pathways and changes in how the brain and body process sexual pleasure. Essentially, the body becomes accustomed to a very specific and forceful type of stimulation, which can't easily be replicated with a partner. This leads us to a related phenomenon that's often referred to quite memorably as death grip. While not a formal medical diagnosis, the term captures a real issue that affects many people, particularly men. Death grip describes a pattern of using very firm, fast, or aggressive hand pressure during masturbation. Initially, it might feel more stimulating, but over time it can desensitize the nerves of the penis, making it harder to reach orgasm or enjoy sex with a partner. From a neurological perspective, this happens because the body adapts or habituates to the level of stimulation it regularly receives. If your body gets used to a strong, consistent pressure or vibration, softer or different types of touch may no longer produce the same response. This is similar to what some women experience when they use high-powered vibrators too often. Eventually, their bodies may crave that intensity to feel the same pleasure. Doctors sometimes refer to this as an idiosyncratic masturbation style. That means the technique or scenario a person uses to reach orgasm is so specific that it can't easily be recreated with a partner. It might involve a certain grip, rhythm, fantasy, or even a particular physical setup. In one study of 500 men experiencing delayed ejaculation, meaning difficulty reaching orgasm, about 37% reported using such unique methods. While there's nothing wrong with discovering what feels good, the concern arises when those habits interfere with partnered intimacy or lead to reduced sensation. It's important to note, however, that not every case of decreased sexual sensation or erectile difficulty stems from masturbation habits. There are many other possible medical causes that should be ruled out first. Conditions like diabetes, low testosterone, and nerve injuries can affect genital sensitivity, as can certain medications, particularly antidepressants, which are known to influence sexual function. Lifestyle factors, such as excessive sitting, especially during the pandemic when many of us worked from home, or long hours of cycling, can also impact blood flow and nerve health in the pelvic area. If you suspect that your masturbation technique might be part of the problem, the good news is that your body has an amazing ability to recover. Taking a break for a few weeks can allow the nerves to reset and sensitivity to return to normal levels. When you resume, try experimenting with gentler techniques or using lubricants to reduce friction. This helps you reintroduce natural sensations without overwhelming the tissue. You might also try avoiding pornography or external visual stimulation for a while and instead focus on your own internal arousal cues, imagination, emotion, and physical touch. Some people find it helpful to speak with a sex therapist, particularly one trained in techniques like sensate focus, which encourages you to reconnect with physical pleasure and intimacy without pressure to perform. It's a great way to retrain your mind and body to experience pleasure more naturally and with greater awareness. In rare cases, Aggressive masturbation techniques can even cause more serious injury. If a man forcefully bends an erect penis, it can lead to a penile fracture, a rupture of the fibrous tissue that surrounds the erectile chambers. It's as painful as it sounds and is considered a surgical emergency. Signs include a sudden popping sound, swelling, bruising, and immediate loss of erection. Anyone who experiences these symptoms should seek medical attention right away. Even milder trauma, like masturbating with a semi-erect penis or using extreme pressure, can cause microtears that later form scar tissue, potentially leading to curvature of the penis, known as Peyronie's disease. For most people, though, masturbation remains a safe, enjoyable, and beneficial part of life. It's only when the practice starts to interfere with intimacy, pleasure, or daily functioning that it's worth taking a closer look. If you're able to maintain a balance, meeting your responsibilities, nurturing your relationships, and still enjoying self-pleasure without guilt or pain, then you're likely doing just fine. That brings us back to the big question, how much is too much? The answer is less about numbers and more about impact. If masturbation doesn't interfere with your life, work, relationships, or self-image, there's no reason to worry. But if it starts replacing meaningful connection, reducing your interest in partnered intimacy, or consuming large amounts of time, it may be worth pausing to reflect. In the next chapter, we'll dive deeper into the medical science behind sexual habituation, explore how the brain and body adapt to stimulation, and discuss strategies for resetting your sexual response. Because understanding your body without shame or judgment is the first step toward maintaining both physical and emotional sexual health. When we talk about sexual health, one of the most fascinating and often misunderstood aspects is how adaptable the human body and brain really are. Our nervous system is designed to respond to pleasure, but it's also wired for efficiency. Over time, with repeated exposure to the same type of stimulation, the brain learns to expect that pattern and may begin to rely on it. This process, known as habituation, plays a major role in how we experience sexual pleasure and arousal. It's why certain forms of masturbation can sometimes lead to decreased sensitivity or difficulty climaxing during partnered sex. Let's break that down. Every time we experience sexual stimulation, the brain releases a cascade of chemicals, dopamine, oxytocin, serotonin, and endorphins that work together to create feelings of pleasure, satisfaction, and relaxation. Dopamine in particular is a powerful motivator. It rewards behaviors that feel good and encourages us to repeat them. That's why pleasurable experiences, from eating dessert to sexual activity, can feel almost addictive. But when the same pattern of stimulation is repeated too frequently or too intensely, for instance, with very tight grip pressure or powerful vibratory devices, the brain and body can become conditioned to those exact sensations. Anything less intense might then feel unfulfilling or even unarousing. This doesn't mean you've damaged your body permanently, rather your nervous system has adapted. Think of it like developing a tolerance to caffeine or spicy food. The more you have, the more your body adjusts, and the more you need to achieve the same effect. In sexual terms, this can translate to needing more stimulation, longer sessions, or specific scenarios to reach orgasm. And when those habits become too ingrained, sex with a partner may not feel as satisfying because the sensations, rhythm, or level of friction don't match what the body has learned to respond to. This phenomenon is especially common in what physicians call delayed ejaculation or anorgasmia, the inability to reach orgasm. In clinical practice, I often meet patients who worry something is broken because they can climax during masturbation, but not with their partner. When we explore their habits, we frequently find they've developed a very particular masturbation style, perhaps with a certain grip, speed, or even mental fantasy that can't easily be replicated in partnered intimacy. This can create frustration, self-doubt, and anxiety, which ironically only make the problem worse. It's important to recognize that this issue doesn't only affect men. Women, too, can experience desensitization, particularly with frequent use of high-powered vibrators. The genital tissues and nerve endings can adapt to strong vibrations, making it harder to reach orgasm through other forms of touch. That's why I often remind patients that moderation and variety are key. The goal isn't to eliminate self-pleasure, but to maintain balance and awareness of how your body responds. For anyone experiencing changes in sensation or difficulty reaching climax, the first step is to rule out underlying medical causes. Low testosterone levels, for example, can reduce libido and slow sexual response in men, while hormonal fluctuations, menopause, or certain medications can have similar effects in women. Antidepressants, especially selective serotonin reuptake inhibitors, SSRIs, are well known for causing delayed orgasm. Chronic conditions like diabetes can also impair nerve sensitivity, as can excessive alcohol use or recreational drugs, which dull the nervous system's responsiveness. Even lifestyle habits like prolonged sitting, particularly for those working long hours at a desk, can reduce blood flow to the pelvic region and affect sensation. If medical causes are ruled out, the next step involves gently retraining your body's sexual response. This process can be surprisingly effective, but it requires patience. Taking a temporary break from masturbation, typically a few weeks, allows nerve sensitivity and psychological arousal patterns to reset. When resuming, use a lighter touch, slower pace, or lubricant to create more natural sensations. Lubrication not only reduces friction, but also enhances comfort and pleasure, helping you reconnect with physical sensation rather than forceful stimulation. Equally important is addressing the mental component of sexual pleasure. Many people rely heavily on pornography for arousal, which can train the brain to associate sexual excitement with visual novelty or specific scenarios that may not occur in real life. Over time, this can make it harder to feel aroused by a real partner, especially if the stimuli don't match what your brain expects. Limiting or taking a break from porn can help reestablish sensitivity to more subtle, emotional, and physical forms of arousal. For couples, this is a wonderful opportunity to rebuild intimacy and rediscover what feels good together. Practices like sensate focus, developed by sex therapist Masters and Johnson, are designed to reduce performance pressure and refocus attention on touch connection and pleasure without the goal of orgasm. It involves setting aside time to simply explore each other's bodies, noticing sensations and emotions without judgment or expectation. This helps calm the nervous system and rewire the brain to associate sexual activity with relaxation and closeness rather than anxiety about performance. Another concern that sometimes arises from vigorous or repetitive masturbation is physical injury. While rare, excessive force or bending of the penis during arousal can cause serious harm. The most severe form, a penile fracture, occurs when the thick fibrous tissue surrounding the erectile chambers tears under pressure. Patients often describe hearing a pop, followed by intense pain, swelling, and bruising, a clear sign of emergency. Immediate surgery is usually required to prevent long-term complications like curvature or erectile dysfunction. Even less severe trauma, such as repeated bending or pressure against a semi-erect penis, can cause microtears. Over time, this may lead to the formation of scar tissue or plaques that distort the shape of the penis, a condition known as Peyronie's disease. While this condition isn't life-threatening, it can cause pain, anxiety, and difficulty during intercourse. The best prevention is awareness. Avoid bending, twisting, or applying excessive pressure during arousal. And listen to your body if something feels uncomfortable or painful. At this point, you might wonder, is there such a thing as the right way to masturbate? In truth, there's no universal technique because every body is different. The most important thing is to find what feels pleasurable without causing pain or long-term changes in sensitivity. A good rule of thumb is that masturbation should leave you feeling relaxed and satisfied, not sore or frustrated. It should complement your sexual life, not replace or diminish it. When self-pleasure becomes compulsive, for instance, if you find yourself doing it repeatedly throughout the day to the point of interfering with work, relationships, or responsibilities, and may be a sign of deeper stress, anxiety, or even emotional avoidance. In such cases, the goal isn't to eliminate masturbation entirely, but to understand what underlying needs it might be fulfilling. Therapy can be incredibly helpful for exploring these connections and developing healthier coping strategies. It's worth remembering that sexual habits don't exist in isolation. They're deeply influenced by our emotions, environment, and mental state. Many people turn to masturbation for comfort, relaxation, or as a way to manage loneliness. There's nothing inherently wrong with that, but if it becomes the primary or only source of pleasure and connection, it might signal that something else, emotional intimacy, self-esteem, or balance, needs attention. The path to healthy sexual behavior lies in awareness, moderation, and compassion for yourself. Just as we approach nutrition, exercise, or mental health with care, our sexual health deserves the same thoughtful balance. Understanding how your body reacts to different forms of stimulation empowers you to make choices that support long-term satisfaction rather than short-term intensity. In the next chapter, we'll talk about what healthy masturbation looks like, how to build sustainable habits, maintain sensitivity, and nurture both solo and partnered pleasure in ways that honor your body and mind. Because when it comes to sexual wellness, knowledge isn't just power, it's liberation. By now, it's clear that masturbation is not only natural but also deeply personal, a reflection of how we connect with our own bodies and understand pleasure. When practiced mindfully, it can be one of the healthiest and most beneficial forms of self-care. But when it starts to feel compulsive, numbing, or physically uncomfortable, it's a sign your body and mind may be asking for a reset. The good news is that our sexual responses are highly adaptable. With some patience, curiosity, and self-compassion, nearly anyone can restore balance and sensitivity while continuing to enjoy self-pleasure as part of a healthy, fulfilling life. A healthy approach to masturbation begins with awareness, noticing not only how often you're engaging in it, but also how it makes you feel afterward. Ask yourself, do I feel relaxed, happy, and at peace? Or do I feel drained, anxious, or disconnected? The answers can offer important clues about whether your habits are serving you or perhaps masking something deeper. Masturbation should enhance your life, not interfere with it. If you're still meeting your responsibilities, maintaining fulfilling relationships, and engaging in activities that bring you joy, your sexual routine is likely balanced and healthy. But if you find yourself choosing masturbation over social interactions, intimacy with a partner, or productive tasks, it might be time to reflect on how often and why you're engaging in it. There's a common misconception that masturbation frequency alone determines what's healthy. In reality, what matters most is its impact on your well-being. Some people masturbate daily without issue, while others feel best with less frequent activity. The key is whether it's enhancing your sense of connection to yourself or becoming a source of stress or avoidance. If you ever feel that masturbation is taking over your time or emotional energy, it doesn't mean you've done something wrong. It simply means your body's cues have changed, and you have an opportunity to listen and recalibrate. For people who experience physical discomfort or decreased sensitivity, the first and simplest step is rest. Taking a short break, even just 1 or 2 weeks, can do wonders for restoring nerve sensitivity and resetting your brain's arousal pathways. During that time, try focusing on other forms of relaxation or stress relief exercise, mindfulness, journaling, or creative hobbies. These can fulfill some of the emotional or physiological needs that masturbation often meets, like calming the nervous system or releasing tension. When you return to masturbation, think of it as a chance to explore rather than perform. Use it as a way to connect with your body, not just to reach orgasm. Try slowing down, breathing deeply, and paying attention to the sensations that build over time. Incorporating a water-based lubricant can greatly enhance comfort and allow for a wider range of movement, making the experience gentler and more pleasurable. Experimenting with different hand placements, rhythms, or fantasies can also help you rediscover new sensations and break free from any repetitive patterns that might have contributed to desensitization. Another helpful strategy is to become more attuned to mental stimulation rather than relying solely on physical or visual triggers. Many people find that using imagination rather than pornography can strengthen their connection between mind and body. Fantasizing about scenarios that evoke emotion, intimacy, or excitement rather than focusing only on visual arousal helps retrain your brain to respond to more organic, real-world experiences. If you do choose to consume adult content, do so mindfully. Look for ethical sources, avoid extremes, and pay attention to how it makes you feel emotionally and physically afterward. Pornography isn't inherently harmful, but when it becomes the main source of arousal, it can alter how your brain processes desire and intimacy. If you're in a relationship, open communication is essential. Many people struggle to discuss masturbation or sexual concerns with their partners, fearing judgment or misunderstanding. But in reality, these conversations often bring couples closer together. Sharing your experiences or frustrations with sensitivity can open the door to more fulfilling intimacy. Your partner may appreciate the honesty and even want to explore ways to reconnect sexually, perhaps through sensate focus exercises, mutual exploration, or simply spending more time being physically affectionate without the pressure of sex. These approaches not only improve sexual satisfaction, but also rebuild trust, emotional connection, and self-confidence. For those experiencing more complex or persistent difficulties, such as delayed ejaculation, loss of sensation, or compulsive sexual behavior, working with a sexual health specialist or therapist can be incredibly helpful. Professionals trained in sexual medicine or therapy understand the intricate balance of hormones, neurology, psychology, and relationship dynamics that influence sexual health. Therapy isn't about judgment, it's about education and empowerment. A skilled clinician can guide you through exercises, mindfulness techniques, or behavioral strategies that help restore a healthy relationship with your body and sexuality. It's also worth remembering that the health of your pelvic region plays a significant role in sexual function. Regular physical activity, pelvic floor exercises, and maintaining good cardiovascular health all support optimal blood flow and nerve function to the genitals. Chronic conditions like diabetes, high blood pressure, or obesity can impair sexual sensation, so addressing these factors through diet, movement, and medical care can significantly improve overall sexual health. Ultimately, the goal isn't perfection, it's balance. Sexuality, like every other aspect of health, exists on a spectrum that changes throughout life. Stress, aging, medical conditions, and emotional factors can all influence how our bodies respond. Being aware of those changes without shame allows us to adapt and care for ourselves more compassionately. There's no need to measure your sexuality against anyone else's. What's normal for you may look different for someone else, and that's completely okay. If there's one takeaway I want you to remember, it's this: masturbation is not the enemy. It's a natural, healthy expression of sexuality, a form of self-pleasure, stress relief, and bodily awareness that can coexist beautifully with partnered intimacy. Problems arise only when it becomes physically harmful, emotionally isolating, or compulsive to the point of distress. But even then, it's never too late to make changes, seek help, and restore a healthy, satisfying balance. You deserve a sexual life that feels fulfilling, connected, and free of guilt. That starts with understanding your body, respecting its limits, and treating pleasure as an important part of your overall health, not as something to hide or feel ashamed about. If you're ever unsure about your experiences or feel pain, loss of sensation, or emotional distress related to masturbation, please talk to a qualified healthcare professional. You're not alone, and help is available. In the end, masturbation, like any intimate act, is about caring for yourself. It's about learning to listen to your body, celebrate your sexuality, and nurture both your physical and emotional well-being. And as I often tell my patients and viewers, take care of yourself because you are absolutely worth it.